As a child, pigeon pagonis always struggled to conform to society's expectations for them, never feeling like they truly fit in with any of the other girls their age. This feeling was only heightened as they reached their early adolescent years, and they had many questions that weren't being answered. Why did they fit in? All these other girls are doing certain things, and they just couldn't find themselves relating in any possible way. It wasn't until their early college years rolled around that they discovered they were born an intersex child, however, raised a girl. Imagine a roller coaster of emotions that they felt when they found out that their past medical history was filled with fabrications and lies. And all those surgeries left them not only physically scarred, but psychologically scarred as well. According to the Human Rights Watch research, July 25th, 2017, 60% of individuals reported to have experienced traumas later in life after receiving non-consensual intersex genital mutilation surgeries. This is why Congress must address the obvious issue that these surgeries face. Today, I will be discussing the problem of non-consensual intersex genital mutilation surgeries. I will be discussing the long-term health effects, how it violates bodily autonomy, and impacts the individual's gender identity development. Finally, I will be discussing the possible solution of if Congress passes a law that bans these genital intersex mutilation surgeries. Now, first, let's talk about what these surgeries are. According to BMC Medical Ethics, July 24th, 2019, these are surgeries performed to normalize the outer appearance of genitalia to make it so that it better suits to what society deems a proper genitalia should look like. Now, what does intersex even mean? According to Cleveland Clinic, May 1st, 2024, people who are intersex do not strictly fit into the sex classification of being either male or female, and this is due to a variation of chromosomes, difference in chromosomes, their genitals, or internal reproductive organs. And by saying intersex, we're not referring to only one specific condition alone, as the term varies from biological conditions that people can have. Now, these surgeries are pretty common, as according to Human Rights Watch research, July 25th, 2017, there are 1.7% of people who are born intersex and thousands of those who have undergone the non-consensual surgeries. Now that we have learned about the problem with these surgeries, let's discuss their lasting effects. Now, like I said, it's not only physical but psychological as well. Like for pigeon pagonis, when they discovered that all of their past had was filled with fabrications. Imagine being lied to by the doctors that you went underwent a surgery and it turns out that it was something completely that you didn't have consent to. These non-consensual surgeries on intersex individuals often result in lasting physical harm, such as chronic pain, scarring, loss of sexual sensation. These surgeries are being done on their genitals, and when the surgeries conclude, they imagine having a loss of sensation down there, a low libido. You'll have to take certain medications to get that back, and that ruins your whole entire life after that. According to BMC Medical Ethics, July 24th, 2019, many intersex individuals report trauma, anxiety, and also depression stemming from these early medical intervention. Additionally, according to Human Rights Watch, October 26, 2017, the emotional toll of these surgeries is also very significantly high. Many individuals felt disconnected from their bodies after these procedures, and I mean, who wouldn't after this? This is definitely traumatizing. It's something that changes your life and it's something that also could be prevented. It's physically, psychologically damaging, which influences a person's overall quality of life. Imagine the shock. Like I said, imagine the shock that they felt. Put yourself in their positions. Furthermore, performing irreversible surgeries on intersex infants violates their rights to their bodily integrity and self-determination. According to Human Rights Watch, October 26, 2017, these surgeries are often carried out with the individual's ability to provide informed consent. They're solely babies, and their parents are, like I said in the beginning, they're pressured by these doctors so that they can conform to what society's expectations are. But that's just that's just completely wrong. These effects are lifelong. The United Nations has called such surgeries human rights violations, emphasizing that children should have the autonomy to decide whether they undergo such procedures. These procedures are cosmetics. They are considered cosmetic surgeries. They can be postponed until we it is determined that the child can consent for themselves. Surgical assignments of gender can conflict with individuals' gender identity development as they grow up, leading to identity confusion and distress. Like, because of the internal sex organs, you can also have something that's called ovotestes, and this affects your hormones and how you feel, and you can feel like Pigeon was raised a girl. They did not feel that they should be raised as a girl. That's something that's definitely conflicts with them for their whole entire life. The AMA Journal of Ethics, August 2020, many intersex individuals experience gender dysphoria when the gender assigned through surgery is something that does not align with their self-identification at all. Now, after reviewing many effects of these non-consensual intersex surgeries, let's look at the possible solution of passing a federal law that bans these surgeries. Now, there's a clear solution. Congressional action to ban these surgeries must go underway. The clearest and most effective solution to this issue is for Congress to pass legislation that bans these surgeries for individuals as it scars them physically, emotionally, and forever for their life. And it's something that can be postponed, like I said. This would not only protect their right of their bodily autonomy, but it would also prevent irreversible medical damage. Such a law could include certain provisions that delay surgeries until consent can be given, which is something so simple. Wait a couple years. That's all that everyone is wanting, just for some time. Now, the federal law should also mandate education for medical professionals and also people around the world because you never know if it's your child that's going to be the next one. You never know. So instead of having to conform to society's expectations, we should just change society's expectations and educate people that this is normal, that these are normal people and there's nothing wrong with them. Interact Interact Advocates 2024 emphasized that informed decision making reduces the pressure to normalize intersex traits surgically. Education about intersex individuals should be more accessible and more prevalent, and it should be in media everywhere for people to consume. Instead of altering individuals to conform to social norms, we should just change these social norms. Now, today we learned about why Congress must address the issue of these intersex surgeries, these non-consensual intersex surgeries. We looked at the problem of these non-consensual surgeries. We looked at their effects, not only the long-term health effects, the psychological effects, and we looked at how it violates the right of bodily autonomy. And then we also discussed the possible solution of this passing a federal law. Now, remember, Human Rights Watch, July 25th, 2017, 60% of these individuals were subjected to these surgeries and experienced significant trauma. Pigeon Pagonis is one of the many people, many of the 60% that have to live with these consequences for the rest of their life. While they've accepted the reality, this is something that can definitely be prevented for future generations. And thank you.